You probably never think about your feet when it comes to prostate health, but what if they're sending you subtle warning signs about something far more serious? From foot pain that doesn't go away to strange swelling, numbness, or even sores, your feet might hold surprising clues to one of the most common cancers affecting men over 50, prostate cancer. Here's the shocking part. When prostate cancer advances or spreads, it can silently affect your bones, nerves, and circulation, leading to unexpected symptoms in your feet. Persistent foot pain, cold feet, or swelling may not just be the result of aging or poor shoes, they could indicate deeper problems. The last one will totally blow your mind. 1. Foot pain. Could be a warning sign. If you're over 50 and suddenly have this burning or tingling feeling in your feet that just won't go away, it could be something more serious than just annoying foot pain. I'm talking a possible warning sign for advanced prostate cancer, and here's the deal. When prostate cancer spreads in the body, it often heads to the bones in your pelvis or spine. Since those areas are so close to important nerves that control how your legs and feet feel, the growing cancer can end up pressing on those nerves. And that's what causes the sharp burning sensation or numbness in your feet. It's not like normal foot pain that happens from standing too much or bad shoes. This stuff persists even when you rest. I know, it sounds kind of crazy and scary, but in a way, you can think of it as your body throwing up a red flag about what's going on internally, especially if you've had other prostate issues lately too, like peeing all the time or trouble starting, stopping. Combined with this weird nerve foot pain that's just not normal for you, it's definitely something to get checked out ASAP. The key is catching prostate problems early. It makes a huge difference in outcomes. So if you suddenly have foot pain that just doesn't add up, don't ignore it no matter how silly it seems. Bring it up with your doctor stat. Your feet could be trying to tell you something important about your health. 2. Swollen feet and prostate health. If your feet or ankles seem puffy, it could be more than just sore dogs from standing all day or getting older. Bloating in the lower limbs might point to deeper issues, specifically with the prostate gland. Let me break it down. Advanced prostate cancer can muck up your lymphatic drainage system. You know, the network of vessels and nodes that clear fluid and crud from your tissues. When cancer invades or grows, it can dam these pathways, causing backup and swelling downstream in the legs and feet. This condition is formally called lymphedema. Lymphedema bloating tends to stick around and feel tight or uncomfortable, unlike temporary swelling from being on your feet too much. And additionally, common prostate cancer treatments like hormone therapy or radiation can sometimes throw off fluid balance and result in swelling too. If you also have symptoms like peeing troubles, lower back pain, or weird fatigue, it's probably smart to get your prostate checked out. While puffy feet might seem harmless, if the swelling persists or gets worse, have your doc take a look. Your body could be signaling important stuff about your prostate health. 3. Bone pain in feet, an early alarm. If you're over 50 and suddenly having weird foot or heel pain for no reason, it might be more than just getting older or sore feet. Advanced prostate cancer can spread to bones, bone metastasis, and sometimes that causes pain in the feet and. Here's why. Prostate cancer often goes to weight-bearing bones like the hips, spine, back. As it spreads there, it can get to the little bones in the feet too, making this dull, sharp, pressure-like pain that doesn't get better with the usual stuff like new shoes or massage. The bone pain from prostate cancer is usually worse at night or when you're active. You might notice other things too, like lower back pain, feeling tired a lot, or losing weight without trying. If you've got this odd foot pain, it's your body waving a red flag. It's easy to ignore foot or heel pain, but if it sticks around or gets worse without some injury or anything, don't brush it off. Together with other symptoms, it could mean prostate cancer that needs immediate help. Getting checked out quick could make all the difference in catching it early and protecting your health. 4. Gout and prostate cancer. If you're over 50 and suddenly felt a sharp, burning pain in your big toe or other joints, You may already be familiar with gout. Gout happens when uric acid crystals build up in the joints and cause swelling and extreme pain. But here's a surprise. Gout and prostate cancer might be connected. Research shows that guys with high uric acid levels, which triggers gout attacks, could also be at higher risk for prostate trouble, including prostate cancer and uric acid forms when your body processes certain foods, but if too much builds up in your blood, it can cause inflammation all over. This whole body inflammation may play a part in cancer starting. On top of that, common prostate cancer treatments like hormone therapy can mess with kidney function and fluid balance. This can raise uric acid and set off more gout flares. If you deal with frequent gout flare-ups, especially in your feet, take it as a sign to keep tabs on your overall health, prostate included. Pair this with other hints, like problems peeing, hip and pelvic soreness, low energy, and it's time to see your doctor. Getting gout under control and staying on top of prostate health could help steer clear of larger issues later on. 5. Cold feet, circulation, and prostate health. If you're over 50 and your feet are always freezing, there might be something more going on than just poor circulation or cold weather. This could actually be related to your prostate health, especially if you're getting treatments for prostate cancer. Here's the deal. Prostate cancer treatments like hormone therapy reduce testosterone levels in your system, and while that's necessary to stop the cancer cells, it also messes with your body's ability to regulate blood flow properly. Less testosterone means your blood doesn't flow as well, which leaves your feet feeling cold, numb, or tingly a lot of the time. On top of that, if the cancer has spread to your pelvic area, it can put pressure on blood vessels and nerves going to your legs and feet. That restricts circulation even more, making your feet stay cold even when the rest of your body feels okay. I know having constantly cold feet seems harmless, but if you also have other symptoms happening like peeing all the time, back pain or fatigue, it's worth getting checked out by your doctor. Don't ignore icy feet as just a normal part of aging. It might be a subtle sign that your prostate or circulation in general needs some attention. Catching problems early is key for staying healthy. 6. Neuropathy after prostate cancer treatments. If you're over 50 and suddenly feeling all tingly or burning in your feet, it might be neuropathy. I know, weird name. Basically, it's when the nerves get damaged and send weird signals. This can happen from prostate cancer treatments like chemo. Some of the chemo meds they use to fight advanced prostate cancer can mess up the nerves in your hands and feet. And then you get funky sensations like pins, needles, and tingling, burning, or really sharp pains, numbness that makes walking hard. For a lot of guys, this starts in the feet, then gets worse over time. The chemo beats the cancer, but leaves your nerves janky. That affects getting around and life quality. The neuropathy usually flares up at night or when you're resting, so that interrupts sleep and relaxation. If you're doing chemo and notice this in your feet, don't brush it off. Early help like physical therapy meds or lifestyle shifts can improve nerve function and reduce the discomfort. Pay attention to what your feet say. Neuropathy blows, but you can manage it. Talk to your doc so you can stay active and comfy through cancer treatment. 7. Balance problems and bone health. If you're over 50 and suddenly feeling kind of wobbly on your feet or getting weird foot pain, it might be a red flag for weakened bones from prostate cancer or the treatments. Prostate cancer can spread to the bones in later stages. That's called bone metastasis, and it makes the bones weaker, including the little ones in the feet, so they're more likely to break or hurt. The treatments like hormone therapy used for managing prostate cancer can also cause bone thinning, osteoporosis, by lowering testosterone levels. Testosterone is key for keeping bones strong and healthy. When bone density goes down, it gets easier to fracture bones, even from small falls or pressure on the feet. Weaker bones and the pain can mess with balance, raising chances of taking a spill. At first, you might notice foot soreness, feeling unstable walking, or not trusting your feet. Over time, it can impact getting around and confidence in general. If you've seen ongoing foot pain, unexpected balance problems, or frequent stumbling, don't brush it off. Talk to your doctor about prostate health and bone strength. Simple checks can measure bone density, and early treatment with supplements or medication can help bones stay strong and feet stay steady. 8. Foot ulcers, a hidden red flag. If you're over 50 and you've got sores or ulcers on your feet that just won't heal up, it might be more than just a little problem. It could mean there's something bigger going on health-wise, like prostate cancer. Here's the deal. Advanced prostate cancer can mess with your lymphatic system and blood flow. The lymph system helps drain extra fluid, and the blood brings nutrients and oxygen everywhere they need to go. When cancer grows or spreads, it can get in the way of these systems, so blood has a hard time making it down to your feet. Then when you get small injuries like cuts, blisters, or sores, they struggle to heal up properly and might turn into ulcers that stick around. And at first, these foot ulcers caused by circulation troubles often don't hurt, so they're easy to blow off. But if you don't get them treated, they can get worse and become infected, which puts your whole health at serious risk. If you've got non-healing sores and other prostate-type issues happening too, like peeing a lot, back pain, or swelling in your legs or feet, it's time to talk to your doctor. Ulcers that won't go away are your body's way of signaling that something could be up. Don't write off foot ulcers as no biggie. They might actually be a hidden warning sign that you've got prostate problems brewing that need attention ASAP.